It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hi again, everyone. Jim Knox along with Candace Kruger, and welcome back to another edition of the Best Docs Network, featuring some of the best doctors in the entire Dallas-Fort Worth area, Candace, that help change people's lives.
Indeed they do. We're going to start off with our first best doctor. It's spine surgeon Dr. Michael Rimlawi.
I had been living with neck pain for about 15 years. It took a few of those years to figure out that it was really my neck. It was horrible, lots of neck pain, terrible headaches, nerve pain down my arm. My middle fingers in both hands would go totally numb. Makes it very difficult to work when your fingers are numb if you're working on computers. I had had a bulging disc in my neck. It started out to be just one bulging disc, but by the time we found Dr. Rimlawi and got in to see him, I actually had 3 bulging discs.
We looked at her neck and I said, unfortunately, it was a big portion of her neck. It wasn't just one level. A lot of times people come in, they have 1 or 2 levels. And poor Tara, she had about 75% of her neck that was involved, that had some type of problem in it. She kind of felt that she wasn't fixable. She wasn't able to do the activities that she normally liked.
I couldn't do important things anymore, like my husband and I couldn't go dancing. I couldn't go on walks with my son. We couldn't go play at the park, to the point of not even being able to lift a gallon of milk out of the fridge. The quality of life had diminished greatly, and it was very depressing. This
Type of surgery she had, normally it would have a big incision really from here all the way down. A lot of muscle cutting, a lot of bleeding. So there's a little trick where you can go in between this muscle and this muscle, right between them, right here, and you can get away with really not cutting or hardly cutting any muscle at all. Cosmetically, it's better for the patient. Pain-wise, it's better for the patient. Recovery-wise, it's better for the patient. The relief that I've gotten from Dr. Rimlawi and the minimally invasive procedures is such a godsend. It has been such a blessing in my life and has given me the quality of life back. She's like a whole different person now. That's the best part about this. You see a patient, it's amazing how much neck pain or back pain can change their life and make them into somebody they're not. And then now I see her and she's so happy. That for me is the ultimate gift.
Chest pain can be a scary thing. There are bad causes of chest pain and not so bad causes. So how do you know the difference? Well, generally the bad causes of chest pain, for example, a heart attack, occur with a gradual onset. For example, the discomfort comes on gradually and then goes away gradually. It's usually exertional when you do things like run up a flight of stairs. It's usually dull, not sharp, and that means not like a knife. Knife-like chest pain doesn't tend to be heart-related. Also, if it's heart-related chest pain, you'll tend to get other symptoms like shortness of breath, you'll get a cold sweat, you might even get nauseated or have the pain go to your jaw or to your arm. Now, non-heart related chest pain is a lot easier to figure out and not nearly as scary. For example, it's usually sharp, it's usually sudden, it's usually aggravated by motion. For example, if you have chest pain that's worse when you move or reach or bend or arch your back, that's generally muscles or nerves. And that generally lasts longer. So that's the way you can figure out whether this is heart or not heart. That and whether it's exertional. If you go up a flight of stairs and your chest pain gets worse, and that's pretty predictable every time you go up a flight of stairs, that may be your heart. Check that out, especially if you're older.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education and the Medical Minute tab.
Gynecomastia is a very important part of our practice that I enjoy doing. Gyneco means woman-like, and mastia means breast or chest, so it's a woman-like breast. On a man, that means not just necessarily obesity, but also the glandular tissue that comes along with it, which is the hard, fibrous area that you can actually feel under the nipple and the areola. We see many young men who get it with the onset of puberty, and then we see many men in their 20s, 30s, and 40s who have no antecedent cause for this. Gynecomastia surgery traditionally has not been a very satisfying operation for either the surgeon or the patient. And the reason why is 99% of surgeons are still doing the same technique that's been done for the last 80 years. They put the patient to sleep, they make a 3 o'clock to 9 o'clock incision around the areola, they start cutting out the tissue under direct vision, then it starts bleeding, they can't see very well, they may get a contour problem or a depression, and then ultimately they put drainage tubes in from the side to drain out the fluid. So about 9 years ago, I came up with a new idea. No scar at all on the chest, no drainage tube. We're able to remove the two components of gynecomastia, the fatty tissue and the glandular tissue, through an incision this long under each arm. And there are two instruments that allow us to do it. It's the use of ultrasonic liposuction, and we have a multi-jointed cutting device. We're able to cut out the rest of the glandular tissue with an instrument that goes through this incision all the way down to the nipple. After we've cut all it out and it's perfectly flat, the last thing we do before closing the incisions is to re-inject the entire field with a long-acting anesthetic called Marcaine. So when the patient gets up, we've already got the compressive garment on, they're pain-free. They're typically only in the recovery in 45 minutes to an hour, and that stays numb till the next day. They wear the compressive garment under their street clothes for 3 weeks, and they're done. We see them at 8 to 10 days post-op, or we see them 6 weeks after that, 3 months after that, and they're delighted.
Carpal tunnel syndrome basically is a problem where you have a nerve that's here in your wrist. That nerve shares a common space. It shares it with 9 tendons. When those tendons swell, that soft little nerve gets pinched. The patient can then begin to have numbness and tingling, and if it's there long enough, can notice that his grip strength or her grip strength is diminished. It's important to treat carpal tunnel syndrome early and not wait too long, because the longer that nerve is pinched, the greater the chance that nerve can become permanently damaged if left untreated.
I've been dealing with hand numbness and pain in my hands and fingers for probably 15, 20 years. It progressively got worse, and it got to a point where I couldn't sleep anymore. I couldn't write much more than a check out without a pen falling out of my hand. I would run my fingers through my wife's hair and not be able to feel it on my fingers. And you know, I was missing out on a lot. Keeping me up at night or waking me up at night, it would hurt all the way up into my armpits.
When Steve came to see me in the office and he told me his story, it definitely sounded like he had carpal tunnel syndrome. After examining him and after getting a nerve study to confirm what we suspected, it came back positive for carpal tunnel syndrome in both of his hands. So we proceeded to do the surgery to treat his carpal tunnel syndrome.
The procedure we went with was the endoscopic. I could sleep at night now. I can feel my wife's hair whenever my hands are, run my fingers through her hair. I'm doing just about everything I used to do before.
The good thing about endoscopic surgery is instead of waiting this, a long recovery after one surgery for one hand, we operated on Steve within a week and a half after his first surgery. So he basically had both of his hands done in 1 month.
I wish I hadn't put it off for so long. I don't know how many things I put off because I couldn't use my hands like I wanted to before. I can actually feel my hands and do things, and it doesn't hurt to pick up a pair of pliers or pick up a wrench. I'm glad that I found Dr. Ray, and everything's been great since.
Our bodies need at least 90 milligrams of vitamin C each day. The best way to get your vitamin C is making sure you eat at least 5 servings of fruits and vegetables every day. And welcome to the Best Docs Network. In the studio, we are proud to have Dr. John Barnett, one of the top plastic surgeons in the entire Dallas-Fort Worth area, known for creating some of the most beautiful breasts in the world. What makes a beautiful breast?
Looking natural, feeling natural, and acting natural. By that I mean when the woman moves, they bounce.
All right, Dr. Barnett, you use saline implants and you put them on top of the muscle. Why do you do that?
The saline implants, you have an adjustability factor. Most women are asymmetric in the breast, so you can get them to where they look equal or almost exactly equal. You can't do that with a gel. You got to order different sizes, and they don't come in 10 cc increments. So it's very difficult to get the size right by eye. As good as I am at that, I can't just eyeball it exactly how many cc's difference. Okay, number one. Number two, that's how everybody was taught to do it on top of the muscle. It sounds like a logical idea, but it's a false assumption. It doesn't work. Here's why. Skin stretches. That's why you can take somebody who's really flat-chested and turn them into a 34, 36C. It looks great and natural. Skin stretches, but so does that muscle stretch. It starts out about like this, and then it ends up about like this. But there's no going back from that, okay? It still retains some contractility. That's why when they flex their chest wall muscle, the implant will move around. Looks really nice, really natural, looks good. So when you put it under the muscle, it's an anatomically and physiologically abnormal thing. If a woman's breast is a little bit low set, you have what's called Snoopy's nose effect. Your breast sort of falls off the end. Here's the implant way up here, and the breast sort of falls off. That's why a lot of people get breast lifts in association with their augmentation, because the surgeon's trying to make the patient fit the operation rather than the operation fit the patient. You know, there are a lot of people who got a lot of scars on them that they didn't need.
I came to Dr. Lewis because I always wanted to have really white teeth. And my teeth were straight. I never had to wear braces, didn't have any of those issues, but I had extreme sensitivity. So I could not use any of the whitening strips or just the gels that anyone could. My gums were receding probably because I am one of those brushers that brush the wrong way, didn't do the circular motion.
She really wanted veneers. She had just gone through a lot of personal stuff, and she wanted to make a change in her life, but she really did not want her teeth touched. She did not want anything reduced on her teeth or anything prepared.
So he sort of walked me through the process, and I found out that what he could do was I didn't have to have any, didn't have to have my teeth all filed down. They just sort of buffed them, and he just recreated sort of my smile. It's really strange because it didn't change a whole lot, but it did change a whole lot.
So we did the set on her, and they turned out beautiful. I've done thousands of them, and people are very happy with them. And what we found out is, in most cases, they're stronger, even though they're very thin, they're stronger than regular veneers because the strength isn't derived totally from the thickness of porcelain. I mean, you have to have a certain thickness, but it's derived from the bond to the tooth. And we found that when we bond to the enamel, which is the natural outer layer of the tooth, that we get a much stronger, much harder veneer.
Just the craftsmanship was amazing. I mean, it was like going to a Da Vinci or somebody, because it was such tiny details, but it really changed my smile.
So in actuality, not only are they, less destructive to the tooth, or you don't have to take anything off the tooth, but they're also stronger, and so they look great.
It was painless. Came back, put them on, was getting my hands massaged during the whole process, and I walked out and I had a perfect smile that looked natural. I enjoy smiling, and I love having people say, "Oh, you have the prettiest smile."
As always, for more information on the outstanding doctors you've seen on today's show, you can also check out more videos or even request an appointment. Check out our website. It's bestdocsnetwork.com.
And Candace, you're going to love this next life-changing story. It involves bariatric surgeon Dr. Preeti Malladi.
Before I met Dr. Malladi, I had gotten up to 447 pounds. Normal things that normal people can do that are in shape, I had a hard time tying my shoes. You think that's no big deal. It was hard for me to tie my shoes. You wouldn't believe this, but I used to be a Marine. And so I was always in shape, thinking everything was in shape. And just over the period of years, man, I lost it. I was an excellent basketball player. It got to the point where I couldn't play basketball no more. I stopped playing softball. All of that ceased. I lost out on just doing things with my kids, and that hurt. I came to a point in my life where I realized, man, I couldn't do this no more. And so it's just a lot of, embarrassment.
Roy is a great patient of mine that came to me after struggling with his weight for years and years. He had developed multiple medical problems, including diabetes, high blood pressure, and sleep apnea. And he actually told me that he had really lost hope in his ability to overcome this problem. And we discussed how bariatric surgery can really help him achieve his goals of weight loss, but also to be able to get rid of these other medical conditions. Well, what's interesting with obesity is that adipose tissue is also a hormonal organ, and it actually can affect other medical conditions and cause people who have predisposition to diabetes to get type 2 diabetes or have other medical issues. The fat actually can infiltrate certain organs and cause problems. And so when you perform weight loss surgery, you can actually not only lose the fat, but you're really affecting these medical conditions at their source. And so this is something I want people to be aware of, that helping resolve your obesity can resolve these other medical conditions.
I wish I had did the surgery years ago. I went from 447 pounds to now, I weighed in last week, I was 316. I went from a size 66 waist to now size 50. I'm no longer on my diabetes medicine, and now I feel rejuvenated again, coming back. It makes a big difference, man. And I just want to encourage anybody that's thinking about it, you need to do it. You need to do it.
Another reason to stay hydrated throughout the day is because your brain is composed of 75% water. Your brain will also begin shrinking 0.25% in mass each year after the age of 30.
We've been using preferred imaging since 2001, since I started practicing here, and patients universally come back telling us what a great experience it was. I'm an orthopedic surgeon, board certified in orthopedic surgery and sports medicine. I do a customized knee replacement that is a special technique that is customized for the individual patient. So that knee replacement is based off of an MRI that the patient gets of their knee, their hip, and their ankle. And through that MRI, we feed that into a computer, and it creates a three-dimensional model of their whole leg. And that allows us to be much more accurate in the way that we do the surgery. So the MRI for that knee replacement technique is absolutely essential. It's a special MRI, and Preferred Imaging is specially certified and trained to do these special MRIs. Well, we love Preferred because they do a fantastic job for our patients. They get our patients in right away. They do a wonderful job at customer service and making sure the patient's comfortable through the whole experience, and really just guiding the patient from start to finish through that sometimes scary experience, and making sure that they are as comfortable as they can be. Well, MRI is a very integral part of an orthopedic practice because it's the best imaging test for musculoskeletal problems. So we use MRI quite a bit to establish a specific diagnosis, and that saves a lot of time and effort. You know, the quicker you can establish a diagnosis, the quicker you can get to the bottom of the problem and get it fixed. One of the greatest things about preferred imaging is that they have incredible hours, operating hours. They work from early morning till late at night and 7 days a week, and that convenience is an incredible thing for our patients because they don't have to miss work oftentimes, and they can get the MRI done right away, immediately, so that we get an answer to what's causing their problem and we can get busy fixing it. We send patients to preferred imaging because we have full confidence in their ability to do a really good job for our patients, and they treat them well, and that reflects well on us.
All of the doctors here at the Best Docs Network are dedicated to changing people's lives, and our next Best Doctor is no exception. It's bariatric surgeon, Dr. Philip Swanson.
Well, Anna was about a little over 200 pounds. She had diabetes and high blood pressure.
I had sleep apnea, and I didn't like the way I looked. And I hated that when I would go to the doctors, they would write down obese. And I didn't think size 18 was obese, but medically, it was considered obese.
We talked about the different kinds of procedures that you can do for weight loss, and she wanted the lowest risk operation that you can possibly do, which is the band. And we spent some time discussing the fact that this is a restriction, and you have to be a very dedicated person in follow-up, that you have to carefully follow your intake, and after the few bites that you eat and then you feel full, that's when you need to stop. We all know that your weight is dependent upon how many calories you take in and how many calories you burn. And so if you can burn more calories, then you can lose weight. If you can take in fewer calories, you'll lose even more weight. And she's done very well with this.
I give myself a goal to reach. Once I reach that, then I try another exercise. So I did Zumba, and that was fun, which I would never do when I was fat. It's been an ongoing journey. It's been a positive one. I've enjoyed it every day because every day I see my scale go down. And it's nice to see those numbers go down. Going down instead of going up. Every year prior to that, my numbers went up.
She's lost down to about 130 pounds. And the benefit of losing that weight is now her diabetes is essentially resolved.
The sleep apnea is gone. I sleep much better at night. Now I'm a size 8, and I'm even more in size 6s. And when I pick them up, I think, that is too tiny. And then when I walk by and see myself in the mirror, I have to walk back again and step out. Is that me? I hadn't seen myself skinny. Not since high school. You're hot. I like what I see.
Hi, I'm Dr. Preeti Malladi with Best Docs Network. Did you know that obesity can increase your risk of sleep apnea and that bariatric surgery can help? To learn more, watch my videos on bestdocsnetwork.com.
Carrie is a young lady who complained of breast hypoplasia, which means small breasts. Her breasts were small and she wanted larger breasts. She also had breasts that were not what she thought was normal because she had a tubular breast deformity. What that means is that the nipple was very, very prominent and pointy as opposed to a more natural appearance. So she wanted breast augmentation, larger breasts. She was an A cup and she wanted more of a CD cup. And she also wanted to correct her tubular breast deformity or the prominent nipples that she had.
It was just something I really wanted. I wasn't comfortable with my body at all. I couldn't wear bikinis at all. I couldn't talk in public. So I just thought if I get the surgery, that it would help me out. When I first met Dr. Azouz, I thought He was very friendly and was always smiling, and that would make me smile and feel more comfortable. And he explained everything perfect to me.
Tubular breast deformity is quite common. Many women have a tubular breast deformity where the nipple doesn't sort of lie flat on the breast and is very prominent. In very severe cases, the breast looks like a tube with a pointy nipple on the end. So the object is to make it rounder, to give them cleavage so they don't have these pointy breasts. In Carrie's case, what we did is a correction of her tubular breast deformity, and we also gave her increased volume.
At first I was an A cup, and now I'm a 36D, and I just love that. I was surprised I couldn't stop staring at myself in the mirror, looking at the new me, and I would just stay in my room and just keep looking at myself, and I would turn sideways and all that. I love going shopping now. I really do. Because you can wear whatever you want without worrying about if the cut's too low, how you're gonna look in it. I love wearing different stuff now. The dresses, the bikinis, everything. I just love it.
Laughing not only eases stress, promotes social bonding, and lowers blood pressure, and may also boost your immune system. So bring some humor into your life.
Well, Jesse came to me complaining of low back pain and leg pain. It had been plaguing him for several years and been progressively getting worse. It was to the point where it was affecting his job.
Every time I had a back spasm, I'd be out for 2 or 3 days where my back would hunch over for, I'd be stuck in this weird, awkward sideways position, hunched sideways. And every night when I went to sleep, I dreaded going to sleep because I knew I'd wake up in pain. Sure enough, it was a bulging disc on L4 and L5. Well, initially, and my doctor referred me to a spine specialist that he was familiar with and comfortable with. So I saw him for a while. I went in for cortisone injections. Went through that, went through physical therapy, and all of it helped, and it did help alleviate some of the pain, but it eventually came back. So the doctor recommended actually having some type of invasive surgery. And it was something I just felt really wasn't comfortable with. And luckily at that time, Dr. Williams told me about the Accuroscope procedure.
The Accuroscope procedure is a minimally invasive spine surgery that addresses conditions of the spine, including herniated disc, bulging disc, degenerative disc, and/or scar tissue in a patient's spine.
The way he presented it was, here are the facts, here's what's been done on other patients, and here's the proven success rate.
Oftentimes patients come to me, and they're in so much pain and have their extremities affected so much that they can't walk without using an assistive device. That'd be a wheelchair, a cane, a walker. Upon doing the Accuroscope procedure, a lot of these patients no longer need an assistive device.
When I woke up from the surgery, I knew that it had worked. There was this weird feeling of intense pressure gone from my back.
After Jesse had the Accuroscope procedure, he followed up with me, and I determined that Jesse's pain was 100% gone.
I have now been able to focus more on work, focus more on and enjoying my family, getting just good quality sleep. I've been pain-free for 9 months now.
That'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best doctors, of course, in the entire Dallas-Fort Worth area that help change people's lives. The good news is, Candace, for more information on all these outstanding doctors, you head to the website, bestdocsnetwork.com.
And if you have a question or comment for us, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.